The Great Seal of North Carolina and the North Carolina Department of Health and Human Services logo is displayed. A disclaimer is provided, stating, names, characters, and contact information in this video have been created for the purpose of this tutorial video and are not real. Any resemblance to actual persons, places, or events is purely coincidental. 3 doctors standing in a doctor's office filing room. A pop-up speech bubble appears.
How do providers assist Medicaid beneficiaries requesting to move from a standard plan to a tailored plan? Just use this simple step-by-step guided process.
Green boxes and animated doctors are displayed. The screen displays standard plans meet the needs of most Medicaid beneficiaries, and the terms physical health services, behavioral health services, pharmacy services, and long-term services and supports are shown.
Standard plans provide health care services that meet the needs of most Medicaid beneficiaries.
Blue boxes and animated doctors are displayed. The screen displays some specialty services are only available in tailored plans, and the terms severe mental health illness, severe substance use disorder, intellectual developmental disability, I/DD, and traumatic brain injury, TBI, are shown.
Tailored plans provide additional services related to conditions for individuals with a serious mental illness, severe substance use disorder, intellectual developmental disability, also called an IDD, and traumatic brain injury, also called a TBI.
The outside of a clinic with people outside. A red arrow that says request to move appears.
Beneficiaries who have these conditions or need services only offered in a tailored plan use the request to move to a tailored plan process.
A laptop displaying the Submit Forms online page.
To begin the process, go to the Submit Forms online page at ncmedicaidplans.gov.
A laptop displaying the Submit Forms online page scrolling.
From this page, a provider or care manager can submit the request.
A laptop displaying the health plan change options and selecting the provider option.
If the requested service is needed immediately, a provider or care manager can submit the request to move. They can provide information about the beneficiary's health care needs. To begin the submission process, select the I want to request to move a beneficiary to a tailored plan. I am a provider or care manager option.
The fields for the beneficiary information display and typing is shown in the fields.
Next, fill out the required information, which includes the beneficiary's name, date of birth, and NC Medicaid ID number, which has 9 digits followed by a letter and can be found on the beneficiary's NC Medicaid ID card.
A call center with a drop-down banner providing information and a phone number.
If you need help finding the beneficiary's NC Medicaid ID number, use the chat tool on our website or call us toll-free at 1-833-870-5500.
An arrow selecting the Start Your Form button.
Select the Start Your Form button.
A scrolling screen displaying a list of tailored plan services.
Remember, you should begin this process because the beneficiary has a condition that qualifies them for a tailored plan, or they need a service only offered in a tailored plan.
A computer screen displaying who the form is for.
Check the I understand checkbox and begin the process by selecting the Start button.
The fields for the beneficiary display and typing is shown in the email and phone number fields.
Step 1 of the process requests the name, phone number, and email address of the beneficiary or legally responsible person. Some information is pre-filled. Select the Next button.
The fields for the provider display and typing is shown in various fields.
Step 2 asks for the beneficiary's provider information, including their name, agency, National Provider Identifier or NPI, phone number, and address. The NPI is required to validate a provider should they want to check the form status.
Typing is displayed in various fields.
Next, provide the name and email address of the person filling out the form who will need to sign at the end of the process.
A computer screen with questions asking about a copy of the completed form.
If you would like a copy of the completed form to be sent to the beneficiary's provider or care manager, select the Yes button and provide their name and email address. Select the Next button.
A computer screen displaying various reasons a beneficiary can request to move to a tailored plan.
Step 3 requests information related to why the beneficiary is requesting to move to a tailored plan. You must check at least one of the reasons listed. Selecting some options may require you to provide additional information, which may include a diagnosis code or facility names. Select the Next button.
A computer screen asking if there is an immediate need for services, and selecting various buttons during the process.
Step 3 also requests if there is an immediate need for special services within the current month. If you select the Yes option, you are required to complete a Service Associated Request, or SAR, form. You have the option to complete the SAR form online or upload your own form. If you select the I want to upload my own SAR form option, a button is displayed to upload the document. To complete the SAR form using our guided process, select the I want to complete the SAR form online option and then select the Next button.
A screen displaying the fiable SAR form fields.
The next screen will display the online SAR form. During this step, you will be asked to provide the beneficiary's address. Other information about the beneficiary will be pre-filled from Step 1.
A screen displays the beneficiary portion of the fiable SAR form.
Next, provide the beneficiary's current standard plan's name. You must provide any diagnosis codes and descriptions, in addition to the facility and address where services will be delivered.
A screen displaying the provider portion of the fiable SAR form.
You will also be prompted to provide information about the provider delivering the service if they are different from the provider requesting authorization.
A screen displaying the service information portion of the SAR form.
Lastly, you are required to provide information about the services being requested. This may include procedure codes, dates, the service name, and a detailed explanation of the services. You can add multiple services by selecting the Add Another Service button. Once you have completed filling out the SAR form, select the Next button.
A screen displaying the various documents a provider can upload.
Step 4 requires you to upload any documents supporting the SAR form. This can include any psychological evaluations, hospital discharge summaries, or other assessments.
Various screens display showing how a provider can upload documents.
Select the Upload Documents button and attach as many as 10 documents. Once you finish uploading documents, select the Upload button. Last, select the Continue with the Form button to finish the Request to Move process. Select the Next button.
A screen displays the Read and Confirm page of the process.
Step 5 requires you to acknowledge the request and allow North Carolina Medicaid access to the beneficiary's health care record to make a decision. Read the entire screen before selecting the Send link to my email to sign the form button.
A screen displaying what happens after the form is submitted.
You must go to the email address you provided to sign the form. The beneficiary or legally responsible person must also sign the form to submit the request.
A laptop with an envelope and an email pop up with a sample request to move email.
Go to the email address you provided and click the link within your email. Confirm the information on the form and sign the form to submit the beneficiary's request to move to a tailored plan.
A doctor in a doctor's office on the phone, followed by a woman sitting on a couch in a living room on the phone.
After you sign the form, it will be sent to the beneficiary or legally responsible person at the email address provided in Step 1. Ensure the beneficiary knows to check their email to sign the form and complete the request to move process.
A call center with a drop-down banner providing information and a phone number.
If you have not received an email within 5 minutes, or if the email address listed is incorrect, use the chat tool on our website or call us toll-free at 1-833-870-5500.
A calendar with the number 7.
You and the beneficiary will have 7 days from the date of the email to sign the form.
A laptop with an envelope and an email pop up with a sample request to move cancellation email.
If you and the beneficiary do not sign and submit the form by the 7th day, the request will be canceled. A new request will need to be submitted if the beneficiary still needs services only available in a tailored plan.
A man sits at a desk in an office, typing on a computer.
Once the document is digitally signed by you and the beneficiary, the request will be received and reviewed. The provider will be contacted if additional information is needed.
A calendar with the number 1.
If you fill out or submit a SAR form, a decision will be made in 1 business day.
A girl reads a letter from a mailbox outside of a home with a speech bubble that says, "I'm approved."
If the beneficiary is approved to move to a tailored plan, they will receive a letter telling them that they will be moved retroactively based on the date of the request.
A calendar with the number 5.
If you did not submit a SAR form, a decision will be made within 5 business days.
A girl reads a letter from a mailbox outside of a home with a speech bubble that says, "I'm approved."
If the beneficiary is approved to move to a tailored plan, they will receive a letter telling them that they are enrolled beginning on the 1st day of the following month.
A girl reads a letter from a mailbox outside of a home with a speech bubble that says, "I'm not approved."
If the request is not approved, the beneficiary will get a letter stating they will stay in their current plan, with instructions on how to appeal if they don't agree with the decision.
A call center with a drop-down banner providing information and a phone number.
If you have any questions, we can help. Use the chat tool on our website or call us toll-free at 1-833-870-5500.
The Great Seal of North Carolina and the North Carolina Department of Health and Human Services logo is displayed. A disclaimer is provided, stating, names, characters, and contact information in this video have been created for the purpose of this tutorial video and are not real. Any resemblance to actual persons, places or events is purely coincidental.